So today's session is with the team from an organisation called Promptly Health. I'll let the team introduce themselves in a second. The focus really today is around the use of health data and research from the perspective of a global health company, so slightly different on the world. So I'll sure shut up now. I'd really like to ask Michelle, as part of the team, to get us started. Michelle, the floor is yours, and you can take it from here.
Thank you, Chris. Thank you very much for the introduction, and lovely to meet everyone. Thanks for joining today. It's lovely to be here, and thank you to Chris and Alison for organising this session. So I'll start with a quick introduction of myself and my colleague Antonio, who will be leading the session today. So I'm Michelle. I am the UK representative. So I oversee all Promptly's work in the UK. That's largely with partners, providers that we work with, largely the NHS, and industry, so life science companies that are looking to access data for research purposes. My colleague Antonio will be leading the presentation today. He works in the engineering team at Promptly, and he's one of our specialists when it comes to the model in which we allow health data to be accessed for research purposes, data federation, which we'll go on to talk about in our presentation today. So as Chris said, we're here today to deliver hopefully an educational session on the safe and secure use of health data for research and innovation purposes. By way of a very short introduction to Promptly, we'll keep it less focused on us today, but we are a technology company that has a suite of digital and data products that helps both NHS trusts, providers, and industry to collect, standardize, and analyze data for research purposes. Why did we offer to run this session today? Why did we engage with Chris? Well, as a technology company working in this space, we feel we also have a duty of sorts to help educate and develop understanding amongst patients who are at the core of this work. To help their understanding when it comes to what exactly does it mean when we talk about accessing data for research purposes. What exactly happens? What are some of the steps involved in allowing that to happen? And how can we help hopefully shed light on what that means in a practical sense? So that's the essence of the presentation today. We do encourage questions, we do encourage opinions, thoughts, comments, and I should say that we are also here to learn. We are also here to learn how we as a technology company can improve our communication around this, improve our messaging, and improve how we engage with patients on what we do. So hopefully we'll learn as part of this session today as well. I'll hand over to Antonio to kick off.
Okay, thank you, Chris and Michelle, for the wonderful introductions. And I'll kick off really on this leg of, again, our mission at Promptly is really to empower patients and health organizations with better evidence on the outcomes of care, right? So everyone is interested in better healthcare, and we want to know and to ensure that these better outcomes are based on sound studies and on sound evidence. And in order to achieve that, we work around these 5 principles of safety, right? So we help ensure that data is collected in a safe manner by working together with hospitals, GPs, and any healthcare organization that interacts with patients to help them collect better and more quality data. And then we also help ensure that this data is always safely shared, right? So not everyone should be able to access your record. Only people that need to access your record for your direct care should be able to see it. And this leads on to privacy, right? Privacy is always at the core and at the center of what we do, and ensuring that when people are analyzing your data for research purposes, any identifiable information is replaced and omitted in order to safeguard your personal privacy. And even when you're using data for research, it's important to know who's using it and what for, right? So safe people means that only vetted researchers and vetted research projects, right, that adhere to sound ethical principles are allowed to operate on this data. And of course, these insights that people should get from this data also shouldn't be too specific to any single person, right? We should allow people to learn about a group of patients and get statistics, graphs, insight out of this information, but never single out patients too much or get access to records in ways that they shouldn't do it, right? And perhaps to take a step back and to try and picture, to try and give an analogy for what an ideal data sharing solution could look like, it's useful to use this metaphor of a library, right? We're all familiar with libraries, I hope. We've all been to one. We've all benefited from one. And we also know that libraries many times have special collections, right? They have special books that aren't to be touched by just anyone. And if you want to have access to these really highly valuable books, you have to be vetted, right? You go to the front desk, you ask what the process is to get books, and the person at the desk might ask you a few questions about what do you want to use the books for? What's your end goal here? And what information do you need? What books do you want to access? And even if they allow you to then go visit these books, um, they'll control how you can actually access them, right? Many times you won't get to touch the books. You might not even get to read the books, but you might be able to request specific information from specific parts of the book, right? You'll get the book read to you, sort of say, right? And you'll leave the library with the knowledge that you were looking from those books without ever actually having to move the books out of the library and without ever having to touch or harm the book itself. And if you replace books with health data and library with federated network in this analogy, it actually does play well into the kind of process and the kind of flow that we were hoping to set up with our own evidence network, right? And when we're talking about health data, it's important to really center around what it means and what is it actually useful for, right? And we all know kind of examples of what health data means, right? Because we're the ones generating it when we go to the doctors, when we get exams taken, when we get a prescription. All of these records, they're stored, and many times they're used when someone is caring for us, right? They can access our medical history and they can see what medications we're taking, what diagnoses we've had in the past, if we've been operated on, et cetera, et cetera. And this is crucial information for any care provider to know important context about the patient they're handling. And on a larger scale, we also saw, especially during COVID, how health data, especially about infectious diseases, helps track spread and helps keep, infections under control, right? Because we can see where disease is spreading faster and associate it with different indicators, such as what treatments are we applying, et cetera, to know and to better keep populations safe. And at the end of this chain of value, so to say, is always this, right? Is always this ability to give better care based on informed and patient-centered decisions, right? So we know facts about the patients and how they're reacting to treatments through the data that then allow us to improve the care that we give these patients. And research is where patient data is often really crucial, right? Because research only has this window into the patient's sphere, which is the data that patients generate. And it's, of course, essential in order to advance our understanding of health and to help develop better treatments. And one thing that is important and really crucial to ensure for research is that data is diverse enough, right? Because if data is one of our only ways to get information in order to advance this research, if we're only providing data about a specific subset of individuals, we won't know that the treatments we're developing actually will generalize and will work well in the general population. So in order to avoid biases, having as much data and as diverse data as possible is something that's really important. But this need for more and more encompassing data should always be balanced with the duty to respect privacy and to keep information safe. And this is where lengthy processes come in and trying to ensure that data is safeguarded and used only for proper purposes, right? And this slide here is from HDR UK, and of course the annotations are ours. But what we're trying to highlight here is that, of course, this is and should be a very controlled process that is as standardized as possible and as enforced as possible, but there's still a lot of bottlenecks where researchers can get lost and where value becomes also lost in the process. So even to kick it off, right, it's many times really hard for researchers to know where the data they need is actually located at. So they'll have to reach out to a lot of institutions, and this process can be lengthy, it can be quite repetitive, and it's something that has a high burden to repeat, right? You're forcing someone to explain their research project to many different stakeholders, basically repeating themselves to exhaustion. And once they even get the approval, which many times can take months or more, you then get access to data that is itself not standardized. So you get access to data from different hospitals, and then a whole entire process of making it work together starts that you have to do for each research project that you're trying to carry out. And so with these three core constraints in mind is where federated sharing kind of started to take place and started to be designed to sort of eliminate these bottlenecks from the system design perspective, right? So it's built from the ground up to ensure that these inefficiencies can be mitigated. And we can picture it sort of like this, right? So this is a very extreme oversimplification of how these systems work because we want to keep it as engaging as possible, of course. And one thing to keep in mind again is that this data it never gets moved, right? So it always stays where it lives, but it gets connected, right? It gets networked. So the data gets to stay at the hospitals, but it gets to communicate with the other hospitals in a way that allows it to be accessed. And this access, of course, is always very tightly controlled. And actually having systems that are built for connecting data means that we can actually even control access to it more easily, right? Because we're keeping records of everything that's happening in these systems. And then once this data is connected, we also can work with hospitals to help them standardize their data before the researchers come. So as the researchers, as we work with hospitals, we standardize data in bulk and we harmonize their databases to well-known standards so that it's actually easier to catalog the data and make it easier to find for research purposes in order to find, patients with specific diseases subject to specific treatments more easily than having to search for different things in the different places where the data is stored. And one key benefit that also comes from a system like this is that when you do give access to researchers for asking questions to these databases, they'll only get anonymized results back. So since we're working with standards, something that becomes possible is asking questions about groups more easily, because we're all talking the same language, so we can all define groups in this common language. And once you ask about a group, you get answers about the group. You don't get answers about specific patients themselves or about individual patients, so to say. So these answers are anonymized by default, right? Because they're not tied to a specific person. They're coming from a group of people. And anonymization and all this kinds of ways that data can be private is actually something we think is important to take a deeper dive into and to try and understand the types of private data and non-private data that exist. So of course, personal data we're all familiar with, right? So we all tick 100 boxes on websites every day to say that we allow our personal data to be processed. And personal data means data that is directly linked to us as natural persons, right? As people in the world. We have a name, a birth date, we have an address, and personal data is data that contains all of these uniquely identifying pieces of information, right? So It's data that is highly sensitive, and it's, of course, necessary, right? When we're interacting with the system, we need to be able to use our personal details to authenticate and to ensure that we are we when we're trying to get to our information. But it's dangerous to have these details being shared, right? Of course, because they can be used for impersonating and things like that. So pseudonymization comes in and tries to replace these details with a pseudonym, much like writers write under pen names, right? We create the medical pen name for a patient in pseudonymized data, in that we replace all the personal information with slightly more generic details, and we create IDs that allow us to identify that John is actually now patient 001, right? So we can still link all of someone's data to each other, right? We keep consistency in the data, but we remove all the highly specific details and anything that is tied to John specifically only. So perhaps we don't have a day for John's birth date anymore, but we still know that he was born in April of 1989. Anonymization, on the other hand, takes privacy one step further and really removes any possibility of linking back to a specific person, right? Because in pseudonymized data, the fact that we're still getting a full record means that we can still link data from different sources together and piece a very highly detailed profile where we're kind of just playing who's who and filling in blanks for the rest of the personal information, right? Anonymization takes this one step further and tries to prevent this re-identification as much as possible at the cost of some usability. So we have, for example, a database with 100 tests. These 100 tests, even if they're all coming from the same 10 people, let's say, they'll look as if they're coming from 100 different people. And there's some information that gets lost there, right? Because you won't know how people are evolving through time or how specific individuals are evolving through time. You can only see how the tests are evolving through time. So there's some information lost there, but it's more safe to use this data more freely than it is to use pseudonymized data. And with these concepts well defined and in mind, I'll try to go over this journey that your data goes through in a system like this. And in order to see this a bit better, I'll actually switch my sharing to a different window. Okay. And it all starts right with collection. Hopefully you're seeing my screen still. But at the beginning of this journey, of course, is patients, right? A patient who interacts with this healthcare system and generates records. And we have here the case of Meredith, for example, who is a cardiovascular patient. She gets ECGs done. She has regularly prescribed medications and doctor's appointments. She's enrolled in a patient follow-up program where she gets asked questions about how her diagnosis impacts her daily life. And all of this data is generated. And where Promptly comes in is in the step next, where we link all this information and we try to process it in a way that it becomes as useful as possible for research, right? So in aggregation, we don't mean relocalization, right? We don't mean moving data, but we mean linking data. We make sure that a researcher has a sort of a one-stop shop for all of these different kinds of data instead of having to ask 5 different specific questions. They can ask a question to the entire subset of data or the entire data set of data without having to move the data around. And of course, to protect Meredith's privacy, we ensure that this data, as it flows into the system, gets de-identified at the beginning, right? So we remove from the source data all the identifiable information in a way that still maintains linkage. So we're doing pseudonymization at this stage, right? We're maintaining records linked, but we're removing the details that directly identify Meredith and other patients from the data at this very early stage. And then to help researchers make better use of this data, we also do a process of standardization, right? Where we remove inconsistencies and basically, change nomenclature or dosages information so that it's easier for researchers to join information from different sources without having to worry about what all these sources are calling specific things. And once this makes its way into the federated network, what we can do then is, again, use this common language to describe patients. And we're describing a generic patient here, right? A patient that perhaps was born in a group of years and that suffers from a specific diagnosis. And we get access not to one patient's data, but to diverse patients' data from all different kinds of data types, right? So here we're working with more generic data types than perhaps we were at the beginning, right? These are larger boxes that can aggregate measurements data from different sources, right? So you can get ECGs data, but you can also get data from wearable devices, things like that. They all fit into these larger boxes. So it's sort of easier to collate data from different sources. And at the end of the day, what we're really looking to do and improve is basically to foster the cycle of evidence generation, right? Where researchers such as Claire, which we give the example of here, Claire is trying to research better care alternatives for patients with cardiovascular disease. So she proposes a project to Promptly and its partners. Promptly, together with the partners, so together with hospitals and people who control patient data, we vet the research process, the research project, and we allow it to go forward, giving access to Claire to ask questions to this data without ever transferring it to herself. And as Claire gets more insight from the data, she might find out that a treatment is actually more effective for a specific patient population, right? So she finds a new way to treat these diseases that perhaps wasn't being adopted widely. And as this information gets published into research and gets adopted into care guidelines, at the end of the day, what we're really trying to see and impact is that patients with this condition, such as Meredith or someone close to her who suffers from a similar thing, actually get better treatment from the insights that we were able to generate with this better evidence. So this really shows that what we're getting to at here is basically generating value from patients to patients, right? So we learning from patients to get patients better treatments and better care. I'll go back to the slides now. This, oh, sorry. And this example of cardiovascular disease was not chosen at random. We're actually working in a use case very similar to this. So we all know that cardiovascular diseases are hugely burdensome to healthcare systems, right? And they cause millions of deaths, or millions of people are diagnosed with them, and they cause hundreds of deaths and admissions every year. And our plan is actually to work together with trusts in the UK to explore the link between cardiovascular diseases and elevated LPA levels. LPA is a protein test, so it's a blood indicator, right? And it's not a routine test done in the UK, so it's actually very hard to get a significant volume of tests from one specific hospital at a time. So this is a prime use case for getting Federation to help gather insights and share insights from multiple different sources so that we see really where and how LPA is being tested and what value it actually can bring to help improve treatment of these diseases. So again, the anticipated benefits of this study is that we can help optimize the implementation of this test into routine care and ensure that both patients and care providers have a better idea of how it can improve health outcomes across the UK. So to finalize, and because I'm really getting to the end of the presentation now, thank you all for staying with us till now. Why should we all, as patients, right? Because we're at the end of the day, everyone's a patient at one point in their lives. Why should we care that our data is actually well used for research? And of course, one of the main goals is that, again, it helps improve care for everyone. Having more data, more diverse data can help improve and have more research about how healthcare works. And it can also drive more personal care. So by making sure that our data is taken into account when developing new treatments, we can help ensure that those treatments will be more effective for us, right? And in the way by sharing our data, we're also making our voices heard and making our own complex biology play a part in shaping our understanding of human health. And there's also benefits that come from improving this digital infrastructure for data sharing that can actually benefit us outside of research. So one primary use case for this is actually, for example, travel. So when you are abroad and you need to get medical treatment, it's now very hard to get access to your medical history. So many times you have to describe yourself, what your medical history is, if you have any important past diagnoses, allergies, etc. And with better infrastructure, we can allow doctors abroad also to access your own records in a way that's safe for you, right? Because safety, at the end of the day, is really something that's absolutely crucial in anything that we develop in healthcare. Protecting safety and privacy should always be a main necessity and not a second thought, right? It shouldn't be a burden. It should be a primary goal. And these systems should always be designed to keep information safe. And so thank you very much. That is all from my side. Now I think we can get into the discussion part. And we at Promptly also have some things we would like to again learn from the patients here today and to try and understand. But I'll hand it off to Chris to coordinate the Q&As, and thank you very much.
Yeah. Thank you. You got through quite a lot there in a good space of time.